Hi guys, Dr. Lavan here. So today we're going to be talking about mental health in children, a really important subject, and I'm very lucky today to have one of my good friends and colleagues, Dr. Thevan. Now he's actually a consultant at Royal Berkshire Hospital.
That's right.
And he's also an honorary consultant at Great Ormond Street Hospital as well. And he's been working in mental health for how long now?
Yeah, so I mean, including training, over a decade, but as a consultant, 6 years now.
So we're going to be going through a few topics today, going into detail with some of them, others we can bring on in some later videos. Kumran, how have we been managing during COVID at this time?
It's been a difficult time for everyone. From CAMS's point of view, that's Child and Adolescent Mental Health Services, we've had to distance and work from home. I suppose we're in the fortunate position that because we're not dealing with physical health, we don't need to do so many physical examinations. So our trust has been quite good about using technology to do remote consultations via video, via telephone. All our meetings are done distanced. So we've managed to see all of the kids that are on our caseload and keep the service going. But like every other service, we're very aware that people who haven't been seen before have been reluctant to come forward. Lockdown has had its own pressures on adults as well as children. The lack of schooling has been talked about quite a lot in the press. There's been a lot of general anxiety about the effects that this will have on kids. The actualities we'll have to see. If schools restart in September, if we move forward, we'll have to see what impact that has. There's certainly a lot of impact on kids who have been vulnerable to mental illness, and there needs to be a differentiation between dealing with difficult times, where we all feel upset, we all feel worried, we all feel anxious, and actual mental illness, and that's kind of what we do, is try and differentiate that, identify who might be suffering with a mental illness or something that needs treatment, and then try and administer the treatment too. And
in regards to, it sounds probably like a silly question, but I always feel when the patient comes to see us, just seeing us physically is quite a reassuring feeling when they want to talk openly and discuss. How have you guys managed to do that consultation?
Again, there was a lot of apprehension about it, because yes, you want to strike up a rapport with people, and talking about mental health is not an easy thing. I think we're in the fortunate position that most kids are used to talking to other people via screens.
That's true.
It's quite difficult as a child talking to an adult about quite vulnerable things. And there's been, in my experience, dealing with new patients, there's something about talking at home in your comfort zone on a screen to somebody who's not overbearingly in your face, something a bit comforting about that. So I've actually found that quite a lot of consultations have worked a lot better than in the clinic room, where our consultations are quite long. They can last hour and a half, and that's a long time for someone under the age of 8 to have to sit through, especially seeing as maybe half of the questions aimed at parents. So here it's worked quite well that the kids can answer their bits, they can go off and play or go back to their remote learning, and if they're needed they can come back in. So I'm guessing it depends on clinician to clinician. There's a lot of clinicians who don't feel very comfortable using the technology and things like that, but I think you use your general humanity to try and relate, talk about our own experiences of being in working from home and the pressures that we're facing. These kind of things help us, I think.